videos what I have been uploading in obstetrics and gynecology, today's topic of the discussion I'll be mainly focusing upon the antenatal care. Now, nowadays in the present scenario, there has been so much awareness amongst the developing as well as the developed countries that the moment the lady is trying to conceive, the moment the expecting mother, the moment she gets pregnant, there is certain amount there the institutions, the healthcare professionals, the healthcare advancements are so much that we can assess the how the infant, how the fetus is developing in the mother's womb, and at every step we need to, even the common population, they are so much aware that they want that during the entire period of pregnancy, how the journey of the fetus is proceeding towards the final delivery of the baby. So, initially, what is antenatal care? The term antenatal refers to some, it is also called as the prenatal care. Now, this has been a common saying that when should the first antenatal care or the prenatal care begins? So there are certain women who are trying to conceive. So it is mostly said on a general or on a layman term, it is mostly said that whenever a lady who is trying to conceive, when she misses out a period or not more than two periods, if she misses out successively two periods at a time, then she should definitely arrange for an antenatal care visit to the nearest healthcare professional. So, the antenatal care is very important nowadays because it gives you an insight as to what are, whether the development of the fetus is normal, what all abnormalities are there, or if any abnormality is there within the growing fetus, it can be monitored, it can be anticipated beforehand, and when the necessary interventions are carried out, when the necessary interventions are taken, those can be resolved at the very initial stage. So that's the importance of antenatal care in the present scenario. Now, so in one word, if we can need to define that what is it, the antenatal care, this antenatal care is very important to evaluate the health status of both the mother and the infant at regular intervals, to anticipate problems and to do interventions as and when required, and thus to prevent or minimize morbidity. So during pregnancy, there is a state, if it is not handled, it is, if the expecting mother is not taken care of well, it can lead to be a disease state. So that disease state in medical terminology, it is called as morbidity. So doing proper interventions, doing proper care, taking proper preventive measures at the appropriate time, it leads to a much greater extent in reducing the morbidities which can be seen in an expecting mother. So now, why this antenatal care is important? So this antenatal care is very, very important because the patients who are at risk of developing certain complications during pregnancy, they can be taken care well beforehand, and also if there is certain kind of abnormality within the growing fetus, or there is certain kind of an abnormality what is found during the embryonic development itself, it at the right very time it can be intervened, and similarly the patients needs to be counseled about as to how about the health of the developing fetus. Now when we look at the components of the antenatal care, so it is very, very important whenever such an expecting mother visits to a healthcare provider or to a gynecologist or an obstetrician. So these gynecologists mostly say that first of all they are going to carry out a routine physical examination. Now on carrying out the routine physical examination, we need that measurements of the baseline blood pressure, the weight, the body mass index recordings, and the heart and the lung auscultations should be done. This helps to identify the population at risk and enable divided into trimesters or into three periods. The first risk and problems. And at this very stage, if the patient is educated and proper motivation is given, this early intervention is going to cause a decrease in the mortality of the infant as well as the expecting mother. Since during the first trimester is also a time of nausea, vomiting, and the expecting mother is going to have somewhat a lower appetite. So therefore, there is not much gain during the first trimester of pregnancy. Now moving on to the second trimester. So when we look at the second trimester, this involves the care and involves the assessment as to how the baby's growth and development is taking place using the abdominal ultrasound examination, where we assess the baby's body anatomy, and along with it, certain blood tests are to be done to evaluate the well-being of the pregnancy. So, the mother, by the second trimester, the mother now starts feeling the bodily movements, the baby movements within her womb. So, it is very important that during the second trimester of pregnancy, the 2 doses of tetanus toxoid injections are administered during this period. Now, moving on to the third trimester. So the third trimester is a very crucial time, as this is the time where the maximum fetal growth occurs. So the baby's size just before birth, the growth spurt is there, and just before birth, the infant's size, the growing fetus which is now transformed into a child, where it assumes a rapid and an accentuated growth. So the growth spurt is there just before birth. So the maximum fetal growth can be seen during the third trimester. And apart from this, very important fact I'd like to mention here, that there is something called as the gestational diabetes and the gestational hypertension. So during the process of the antenatal care, it is very important that the healthcare providers should keep a strict surveillance on the gestational diabetes and the gestational high blood pressure. Now, what are the issues? So very important for the antenatal care, the healthcare providers must provide an insight, must provide knowledge to the expecting mothers that what are the serious issues during the entire course of pregnancy, what are the serious and the at-risk signs and symptoms, what the expecting mother as well as the family of the expecting mother should be well aware of. So, the patient or the expecting mother must be aware of the at-risk signs and symptoms such as excessive weight. So, the risk signs and symptoms which can pose a threat to the healthy pregnancy, it should be taken care of. So, the at-risk signs and symptoms can be excessive weight gain. There can be swelling, excessive swelling of the feet, the high blood pressure, fever, excessive headache, the vomiting and bleeding anytime during pregnancy is also an at-risk high sign. It is one of the indicator of an at-risk high sign. So bleeding at any time during pregnancy is also a very at-risk high sign, and that too leaking per vaginum and decreased fetal movements. So if the expecting mother at some of the other moments she is finding that there is leaking per vaginum during the third trimester, or there is excessive headache, excessive vomiting, there is excessive bleeding during pregnancy, or there is leaking per vaginum, and if she finds there is decreased fetal movements, these things are the at-risk signs and symptoms which should be immediately intervened, and it should be the expecting mother should get the necessary consultation from the healthcare provider if such things are going to happen. So if there is any possibility that the healthcare provider is asking for an X-ray or CT scan, it should be avoided during pregnancy. Now, most of the very common questions among the expecting mothers is nowadays that what is the normal weight gain during pregnancy? So it has been found that depending since the fetus is enlarging, the fetus is growing in the mother's womb, the expecting mother on a normal, on an average basis, the normal range of the weight gain during pregnancy is from round about 10 to 15 kgs of weight, depending whether the expecting mother is underweight, normal weight, or if she is overweight. So on a rough or a general basis, if we look upon that during the first trimester of pregnancy, there is an increase, the weight gain, what is there, is round about 500 to 1500 grams per month. During the second trimester, the weight gain is round about 500 grams to 750 grams per week. And during the third trimester, the weight gain is round about 750 grams to 1 kilogram per week. So viewers, this is a very important, the antenatal care or the prenatal care, these facts must be very well understood by the expecting mothers. Apart from this, what are the probable questions what the healthcare provider about might ask from the expecting mother. So a detailed history is very important. The healthcare provider who is giving the antenatal care, he is going to have a thorough history of the expecting mother, depending the certain points which he or she might be questioning, that what is the personal and the demographic information of that lady, the past pregnancy history, how it was, the past medical history, whether she was having, the expecting mother is having any kind of a heart disease, kidney disease, or whether she is taking some medicine for any disease, the past surgical history, what the expecting mother has undergone, the personal and the family history, the genetic history, as well as the menstrual history as to when was the last menstrual period, or the regular, whether she was having the cycles of menstruation to be regular or irregular, or any kind of the current pregnancy, how she is undergoing. And apart from this, the psychosocial information. So all expecting mothers, they need assessment at at all stages of pregnancy, and this these questionnaires, getting into the detailed history of the expecting mother is very important in providing the antenatal or the prenatal care. So viewers and students who I've tried my level best to simplify about the antenatal care or the prenatal care, which is very important for an expecting mothers or the mothers who are trying to conceive. On a general basis, this antenatal or the prenatal care should be started no longer than 10 weeks of gestation, and in the expecting mother must get herself the antenatal care visit to a nearest healthcare professional. So viewers and students, if you do like this video, give this video a thumbs up. And if you have any queries or comments, you're most welcome to comment me in the comment section. Students and viewers who are new to my channel, they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.